Let's discuss angina pectoris. Here's everything you need to know about angina pectoris. Angina pectoris means chest pain. Angina pectoris occurs when there is a temporary lack of oxygen supply to the heart muscle, causing chest pain or discomfort. It is usually a symptom of coronary artery disease and is often triggered by physical exertion or stress. The term angina means pain, and pectoris refers to the chest, describing the primary symptom of the condition. The coronary arteries supply oxygenated blood to the heart. When these arteries become partially blocked by plaque buildup from atherosclerosis, the heart muscle receives less oxygen than it needs, especially during exertion. This results in oxygen deprivation of the heart muscle and leads to the chest pain. Unlike myocardial infarction, angina pectoris does not cause permanent damage or death to the heart muscle. That is the main difference between a myocardial infarction and angina pectoris. There are two main types of angina pectoris: stable angina and unstable angina. Stable angina occurs predictably with exertion or stress and improves with rest or nitroglycerin administration. Unstable angina occurs with exertion, lasts longer, and it does not improve with rest or nitroglycerin administration. This is a medical emergency, as it may indicate an impending heart attack. For this reason, unstable angina pectoris is considered an indicator of acute coronary syndrome and should be treated as a heart attack. Patients with angina pectoris often present with chest pain or discomfort, described as pressure, tightness, squeezing, or something else, pain radiating to the jaw, neck, shoulders, arms, or back, shortness of breath, diaphoresis, also called sweating, or nausea or dizziness. In addition, they can present with other symptoms as well. A key diagnostic feature of angina pectoris is pain that starts with activity or stress. If a patient is experiencing angina pectoris, follow these steps. First, assist in administering prescribed nitroglycerin to the patient if you are a BLS provider. If you're an ALS provider, you do not need the patient to have their own prescribed nitroglycerin. You can administer your nitroglycerin. Only administer it if no contraindications are present, such as hypotension or recent use of erectile dysfunction medications. The purpose of administering nitroglycerin is to promote vasodilation, or widen the blood vessels, and enhance blood flow to the heart muscle. Second, provide supportive care and transport the patient to the hospital. Now let's talk about unstable angina. For unstable angina pectoris, treat the patient as if they're having a heart attack. First, give them aspirin to prevent any clot formation from continuing to occur. Next, give them oxygen. And third, assist with nitroglycerin. A quick note: ALS providers can administer nitroglycerin even if the patient doesn't have prescribed nitroglycerin. In addition, ALS providers may be able to administer additional treatments, such as initiating an IV and administering other medications that are indicated. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.